What's going on, everyone? Happy Monday. Hopefully everyone is doing well, staying safe, healthy. I hope you had a fantastic Thanksgiving holiday if you are here in the U.S. And hopefully, if you had to take a COVID test, you tested negative. Or if you had to take a test for any other virus, you tested negative for that as well. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the virus update for Monday, December 2nd, 2024. If you're new to my channel, welcome to my channel. This is where I do the virus update on all things viruses in the United States and around the world. So you want to stay informed with what's going on, this is the place to be. I used to do daily updates, but with how much less data there is now and my crazy schedule, all these different factors, I do videos as needed now. Usually about 2 to 3 times a week. I think we're making our way back up to at least 3 times a week now. We're doing today's video. There'll be another one probably on Wednesday and again on Saturday. I think Mondays, Wednesdays, and Saturdays is going to be the schedule. So anywho, if you're new to my channel, subscribe down below, give this video a thumbs up, hit that notification bell, and share this video with anyone you know, and of course leave your comments down below. Once again today, much like last Saturday, though be it we probably won't do as long of a video as this past Saturday, we have quite a few things to take a look at today. And the first thing actually is not in the United States and comes from England. Antonio Caramia made a post, I believe this was yesterday, well, he quote retweeted, no, this was a few days ago. Point is, we did not get to it on the previous video. About in England, and basically the UK in general, but in England, norovirus lab reports in England by week. And take a look at this trend. We've been seeing a similar trend here in the United States, and that is an upward trend. And you can see as of November 11th's update, it's really started to go up. It says positive norovirus lab reports in England by week, and on November 11th, they had about 300, which, in my opinion, is a really high number for norovirus. It's not a number that anyone should be proud of. It's not a good number, and it just shows norovirus is not just an issue here in the United States. Other parts of the world, such as England, are dealing with norovirus issues right now as well. Already, it was 5 years ago yesterday, a man in Wuhan, China, started feeling ill, becoming the first confirmed case of COVID-19. 5 years ago already. That's really remarkable. And the thing is that we are still in a pandemic, though many people do not call it a pandemic. We are still in a pandemic, and we are now in what is becoming virus soup for many reasons, and a big one being the COVID virus can wreak havoc on your immune system, and a lot of people who have COVID damaged immune systems are constantly getting sick, and we're seeing a lot of different viruses show up at levels not seen in a very long time. So the real effect of COVID, yeah, it is still ongoing. We are still feeling the rash of this COVID pandemic, and people are still dying from the COVID pandemic. People are still being hospitalized. Long COVID, to this day, is still a very big problem. It's a problem that is not addressed enough anywhere in the world at all. All right. Moving on to this, in Bermuda, I believe this is, minister on 2 cases of measles in Bermuda. So the health minister of Bermuda has confirmed now that there are 2 cases of measles in Bermuda. And I did read another article, or at least I think I did, earlier today that said this is the first time in 30 years that there has been an outbreak of measles in Bermuda. So that is pretty significant. And a couple weeks ago, there were earlier reports that there may have been suspected measles cases. Well, as of November 29th, this is now confirmed. There are 2 cases of measles in Bermuda. In Indiana, the state of Indiana, that is, their Department of Health reports the first flu death of the season. This was reported just the other day. It's a reminder that, hey, COVID's not the only virus out there killing people, although it's the one that's probably killing the most still. We don't have the actual death numbers, but hey, flu is also a big issue as well. We used to have accurate COVID numbers. Now There are some numbers out there, but we don't know if it's the actual full number because data is so sparse and so messed up this day and age. All right, taking a look at this. I did a poll last night, and this is not the only poll I'm going to do this week. I got another one that I thought of earlier today that I think it's time we revisit that. Once again, more on that in a little bit. Do you feel the CDC, health leaders, and other officials are doing nothing while people of all ages constantly get sick over and over again? I mean, 94.9% of people said yes, 5.1% said no. It's not the biggest poll we've ever done. 255 votes, 8 hours left. Will it reach 300 votes? I don't know if it's going to hit 300 votes. And also, I would have liked to have seen what would have happened if I could have done the exact same poll over on Blue Sky. This is on X. I would like to do polls on Blue Sky, but for whatever reason, Blue Sky does not have that feature just yet. I'm hoping that eventually they will. And this is leading me to a couple of things here when I was thinking of this. Number one, I mean, we're seeing all these kids get pneumonia, constantly getting sick, over and over again. And we're seeing adults constantly getting sick over and over again. How can we be okay with normalizing this? How? I mean, I'm seeing people posting on social media saying, why am I getting sick over and over again? This never used to happen. What gives? What's causing this? Well, hello. Have you had COVID? If you've had COVID, your immune system could be damaged. It's a real problem. And plus, there's also the issue that the media likes to bring up the most, which is for some of these viruses, vaccination levels have fallen. And that is true. They have fallen, but that's just only one piece of the puzzle. They need to be telling the whole entire story. The other thing is, and I'm going to be doing a poll on this probably this afternoon. You'll get the results on Wednesday. And it's something I've done before. Do you know someone sick right now? And you know what? You can leave a comment down below in this video. Because now that we're starting to become post-Thanksgiving, this morning, I am hearing so many people coughing. I do Amazon. I heard people coughing at the warehouse. I did a few food deliveries this morning. I heard people coughing at the pickups. I overheard someone say on the phone, oh, yeah, so-and-so is sick, and I know this person's sick, and that person's sick. It's starting, I'm telling you. Post-Thanksgiving surge of viruses, virus soup, not just COVID, but virus soup is in full swing. And I think we are going to start to see wastewater increase. So that's going to be the next poll question. I've done it many times before. It's time we revisit that. Do you know someone sick right now? And it'll be a simple yes or no, and it could be with any of these viruses. COVID, norovirus, RSV, pneumonia, you name it, influenza. If it's a virus, or if it's just even a common cold or something they haven't tested for, let me know down below here, and of course over on X, where I am actually going to do the poll. All right, moving on. We have a lot more things to get through. Chronic wasting disease. This is something that I've been tracking for a long time. I do know a lot of people that do hunt. I have a family, and well, they have friends, and you get the point. I know people that hunt, and chronic wasting disease is a real issue. There's chronic wasting management in upstate Pennsylvania, where my grandparents used to live, and it is a real deal up there. Well, apparently in Virginia, well, West Virginia, the issue is getting a little bit more concerning, and West Virginia was how this came into Pennsylvania, if my understanding is correct. So this is not good. It's his first chronic wasting disease case in deer outside of containment zone reported in West Virginia. So how this works is they have these zones that they set up. They're containment zones. If someone should want to hunt in that area, fine, but you have to have the deer checked for chronic wasting disease. You have to check with the head. There's a whole bunch of things that they do. Well, apparently a case was found in a deer, whether it be a hunter or maybe the Game Commission in West Virginia found a dead deer, and it was outside of the containment zone, which means they're likely going to expand their containment zone in West Virginia. Yeah, and the deer also had another disease as well, which is also fatal. So that's not good. Double bubble. That's never a good thing to see here. And if you want to see more about this, this will be making it to the chronic wasting disease section over on my website, which we're going to the website next. And this is something interesting I posted yesterday. You don't have to agree with this. It's just a kind of an observation, or a thought, I should say. And I posted yesterday that I have been seeing projections that the winter wave of COVID will not be as bad as other years. I tend to agree with this, as XEC, that's the next variant that is going to take over, is not a massive change in variants like we saw last year around holidays. Remember JN.1? That was a complete game changer. Well, and it caused one of the biggest winter waves we have seen with this pandemic. However, I feel this could also be bad news for the summer months, when we yet again see another large wave next year. If we have a smaller winter wave, there would be more time for immunity to wane. And get where I'm coming from here? If less people get infected from the winter wave, which part of this could be because we had such a strong summer wave, and partly because we don't have a variant that is much different from the other variants, well, guess what? That's less people becoming infected, which you may think is a good thing, and it is, but it does pretty much just kick the can down the line. At some point, we will have a bigger wave once again. Could it be in the warmer months, meaning next summer? And something else that we also have going on by that point, we'll be overdue for a new, stronger variant. Will it happen? Maybe not. Maybe it will. We don't know. I don't know. But the point is, if we do get a stronger variant down the line after a smaller winter wave, it would lead to a bigger wave next summer. But hey, that's a long ways down the line, and it's just something that I thought was interesting. And here's one of those projections now, and this is on X, from Jelly Roll Blues, and this is an ensemble forecast. He says, here is the latest MAPS forecast. Keep in mind, he has not had a chance to evaluate his new state-by-state initialization. He summarized, we would have a small holiday winter wave nearly 2 months ago. Did not think it would be this small. And yeah, the rise in COVID, believe it or not, and this may be hard for some to believe, but it's actually true. I mean, it's a surprise. Some will say it's not. Some will say it is. The rise in COVID is a bit delayed this year. Usually it starts roughly after Halloween, and that did not happen this year. There are some states, though, that are definitely rising, California being one of them, New York State just ever so slightly, California being the positivity rate that we're seeing rise. But take a look at this. His projection shows we do see a bump from Thanksgiving, but look at that. Small. It only goes up to about 550,000 infections. It actually drops a little bit. Then we see a bit of a bigger rise, up to 700,000 infections by the time we get to the start of the new year. Something to look at. And that would be much smaller than last year's wave. There are several different projections. There's one that also says we'll have higher infections than this. And so only time will tell. But I think at least it's some encouraging news. But the problem is, with so many people having immune system issues, like I have been mentioning, it can lead us into problems with all these other viruses. More people getting infected means more chances you could interact with someone being infected with any one of these other viruses. RSV, flu, pneumonia, measles, whooping cough, pertussis. Pertussis is spreading so much in the United States right now. Alrighty, let's take a look at air qualities around the United States, and then we do have some more data to take a look at. Taking a look at air qualities, you can see here, not too bad in the east. Some places where there's fireplaces, that does cause problems. That's one of the reasons why the West Coast is so bad at this time. You can follow me over on X for more on weather, although probably the better place to do that would be Blue Sky. I'm not leaving X. Climate Data Report staying on X, but a lot of people have left X. I was at 800 followers there at one time. Well, you can see it has dropped. Blue Sky, that's the new and latest thing. That's the trend. That is definitely a growing place. I'm seeing my following for everything going up over on Blue Sky because people are getting tired of X. And, of course, you can also follow me for weather stuff over at Climate Data Report here on YouTube. I am going to have my next weather video. I'm going to do it directly after this video, and it'll be up later on. Kind of a change in pattern coming up for parts of the U.S. in the near future. It's going to actually warm up a little bit in the eastern half of the United States next week, and then maybe get a little colder in the west. Just check that channel out. I'll explain it all there. In Philadelphia on Sunday, 708 EMS incidents. That is still a respectable, good number. 695 on Saturday. That's really good. We're not seeing days over 800 yet, and that is some really good news. Taking a look at what's going on with the burbs right now. In other words, meaning counties outside of Philadelphia, and usually the Monday after a major holiday weekend is busy. Right now, just 12 EMS calls. We've seen a lot busier. Usually the peak of EMS calls being busy comes after the Christmas and New Year's holidays. So we will see what happens between now and then if it starts to go up. But right now, just 12 EMS calls in Montgomery County and in Chester County, Pennsylvania. Not bad either. I think both, I've been monitoring this over the weekend, are running a little bit less calls, number of calls, than last year at this time. That's really good news, but it's too early to say it's going to end up that way because it could really start getting busy soon. Like I said, I'm hearing more people coughing all over the place. All right, sick person call, another sick person call, and a third sick person call in Chester County. So people are getting sick. I mean, it's not like no one's getting sick. It is happening. It's real, and unfortunately, it is going to cause more strain on the hospitals, not just here in Pennsylvania. All around the country, there's about to be an increase in the strain on the hospitals at this time. Speaking of that strain, here is the latest look at the hospital capacity in Pennsylvania. And mind you, some of these hospitals in yellow, which does represent that they're dealing with a high patient volume or some sort of an issue that could potentially be causing overcrowding in the emergency department. Some of these have not updated for some reason. It's showing previous dates like this one here in Westchester, Pennsylvania. It does say high patient volume, but when we click on some of the other ones, some of the dates are not matching up for some reason, like this one saying the 23rd. I don't know why that is. All right, moving on. Taking a look now at what is going on in Canada. And in Canada, the viral activity levels are as follows. COVID-19 is moderate, flu A is low, flu B is low, and RSV is low at this time. All right, Walgreens. This may be a surprise to some, and for others it should be not a surprise because it can also just be the sign of the times. There was not a big increase in testing last week. In fact, testing went down, but there's partly a reason for it. Look at all these white states. There's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Washington, D.C., Donau State. Don't know if that's on there. Now look at this. There's a couple more. You get the point where I'm coming from. These white states did not report last week. So that's that's part of the reason why there's less testing. And also it's just, again, a sign of the times. But the positivity rate nationally did increase at Walgreens, 13.3% versus 12.6%. We're going to have to say because testing is down. That you can't say, oh, well, maybe cases are rising now. It's testing down. But, mind you, any of this data right here, 13.3% positivity rate versus 12.6%, up 0.7%, does not factor in people who just started feeling sick from Thanksgiving. This is the last week's data. We won't know till next week's update what the impact is from Thanksgiving. And chances are we should see more people getting tested this week because if more people are getting sick from the Thanksgiving holiday, well, more people are going to go out and get a test. But I get it. Insurance companies are not always covering a PCR COVID test or any COVID test for that matter. 3,696 total tests. Prior week was 4,323. In New York State, the positivity rate was 15.9%. Hey, that's down by 8%. Testing went up slightly, 132 versus 117. In Virginia, the positivity rate is 16.5%. Prior week was 5.3%. That's a big increase. 11.2%. Testing only went up slightly. 115 versus 113. In Arizona, the positivity rate is 28.2%. The prior week was 24.2%. Difference of up 4%. Total tests, 213 versus 281. California at Walgreens. Hey, this is good news. This is very good news. 8.6% positivity rate. The prior week was 12.7%. That's a difference of down 4.1%. Total test, 152 versus 166. The state of Washington, 12.5% positivity rate. The prior week was 7%. Difference of up 5.5%. Total test, 48 versus 57. And let's end Walgreens in Michigan. 16.9% positivity rate versus 15%. Difference of up 1.9%. Total test, 89 versus 107. If there is, in fact, a Wednesday virus update, well then on Wednesday I'll do more states at Walgreens. And I was also going to do hospital emergency department visits diagnosed. If it's not a busy news day on Wednesday, in other words, between the rest of today, tomorrow, and Wednesday, if I don't find too many news stories like today, we'll do the emergency department visits for people diagnosed with COVID, then state by state, at least the states that are listed. We don't have time to do that today. All right, taking a look at the national COVID level in wastewater. You can see here, COVID levels, yeah, they're starting to go up ever so slightly, but not terribly concerning yet. It is saying high. And respiratory RSV, another respiratory virus, that is rising at this time. Influenza A is rising. Influenza B actually has seen a drop. HMPV is low. Norovirus is rising at this time. And taking a look now at a couple individual wastewater sites, we will do two. Let's go down here to Kinston, North Carolina, and see what's going on there. Medium for COVID, rising ever so slightly, but it has leveled off a little bit. RSV is low, influenza A, influenza B, HMPV not being detected, or maybe it's not being tracked for some reason. Norovirus at this time is running very, wow, look at this. It peaked at October 30th, over 150,000 pathogens. Then it did start to drop, but that is really concerning. No Mpox there at this time. And now let's make our way out a little bit further to the west. Let's see what's going on in Harrison, Arkansas. This is another place that tends to have an issue when it comes to norovirus. And we can see here, COVID is medium at this time. Looks like it's dropped ever so slightly, actually. RSV, influenza A, influenza B, HMPV, not being detected for some reason. I don't know if they're tracking it or if it's just really not existing there. And norovirus at this time was rising. Most recent update does show a wonky movement downward, but hey, it is very high norovirus levels there. And Mpox at this time is not an issue. And to be fair, let's go out to the West Coast, shall we? How about, we're not going to go all the way to the west. Let's go to Salt Lake City and see what's going on there. I'm seeing blue, which means levels are low. Yep, COVID still low. RSV still low. Influenza A is low, but there is a rise going on there. Influenza B is low. HMPV is low. Norovirus is medium and rising slightly, and no Mpox at this time. The latest variant of COVID that is dominating is KP.3.1.1 at 44%, XEC at 38%. There should be a crossover, possibly as early as this Friday, where XEC does rise to the top. We can see here, COVID epidemic status is growing in just one state, Indiana, and it's likely growing in Massachusetts, Maryland, Michigan, Illinois, Iowa, Kansas, Arizona, Utah, and Idaho. And then it's likely decline in some states. And then there's a lot of states that are just not changing at this time, which, who knows, post-Thanksgiving, that's where you could start to see likely growing, increase, and maybe even growing states increase as well. All right, moderate levels of flu now in Louisiana, Georgia, and District of Columbia. And then we do have low levels listed in some states, and still a lot of states that are minimal. I expect this to start to ramp up relatively soon. Looking at New York State, 415 people tested positive on the most recent update. That's actually down a little bit. That's some good news. Taking a look at hospitalizations, they have gone up ever so slightly, but really they're still lower than the highest point on November 25th. So not terribly concerned just yet. We will get a better sense of New York State hospitalizations tomorrow. Most recent update is 389, in the ICU 52. This data does go back from last week. Alrighty, I think we covered a ton today. Next update likely to be Wednesday, unless something changes with my schedule. I'll let you know, and if that happens, well, then maybe we'll try for Thursday. I think we need to get in 3 this week, which means That's Wednesday or maybe Thursday, another one, and then of course Saturday. I am definitely planning an update right now. Saturdays really do work well. If you enjoyed this video, give it a thumbs up. Subscribe down below, hit that notification bell, share this video with anyone you know, and of course leave any comments and questions down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and please, if you're going out and about, there's a lot of people that are infected right now. Some are just in the early stages of being infected from the holiday wave. Be super careful. See you all again, hopefully, on Wednesday. Thanks for watching.